they are exactly in line with what was recommended by the most of the healthcare population, I would say. And it is very interesting to see that between economic and healthcare, the medium point is slightly towards the healthcare. So that is important. Nevertheless, it's a short, and it's supposed to be as short as possible lockdown, which is a difference between the first one. And a key point that I would like to highlight from what he said is that we should keep the barrier measures and even home. And I mentioned that earlier on your channel. And it is of utmost importance, because when we are together at home, especially if we are locked down home, we need to be a protection against each other. We need to protect each other, and we need to be protected from each other. So wearing a mask, washing your hands as often as possible, washing all the surfaces, mopping the surfaces many times a day are of utmost importance to prevent any contamination within your family. So those are key measures, and it may dramatically change the output of this second lockdown.
You say it may change the output.
We should be confident. Again, the effect will be noticeable in the future. Sorry.
You say it may change the outcome of this. You were talking there also about it being, in theory, a short lockdown. Do you really think it's going to be over by the beginning of December, which is when it seems it will be up for an initial review? Or are French people in reality looking at longer than that?
Well, if the whole population is following the advice and all the restriction that have been planned, I think we could be surprised of some results by the end of the month. It will take 3 to 4 weeks anyway to see the effect of those measures. But once again, the president was clear. He made all the explanation that were needed and were lacking for many, many weeks. And now I think and I hope that everybody has understood what was the reason why we should have this lockdown, what are the potential positive effects of the lockdown. He was keen on pointing out the negative effect and trying to dampen all the negative effect from the social point of view and from the economic point of view. So from the disaster medicine point of view, from the global health security point of view, the solution and the fact that it will be coordinated at the European level are all the critical points that we're lacking until now. So we should see that as something quite positive and potentially positive.
Okay, I wanted to ask you there about a point you made about social distancing, hand washing, etc. The French government, like most governments, has really reiterated that message month after month. I think it's fair to say that people in France have let their guard down a little bit. Social distancing, I mean, I've been in Paris over the last couple of months. It's not universally respected. People wear masks. They don't necessarily wear them correctly all the time. And of course, there's the problem, as you say, of what people do when they meet up with friends and family. What can the government do to make it a different situation this time around?
I think the best option is not to be too coercive, but rather to explain, to insist to make positive messages about those, and to really make every effort for those new behavior becoming absolutely normal behavior, a new norm for us, at least for the coming months until next summer. And I think we should really think about it in long-term new behaviors, and the lockdown would be as short as possible if we succeed in doing this. It's a collective point and very critical one.